Good afternoon, everybody. Once again, it's been a while. You're live with Project Elect, enthusiastic leaders engaging in changing times. As always, my name is Robert Hall. I am the chair of Project Elect. We are a conduit of information throughout the community, whether we're dealing with spirituality, dealing with education, community and economic development, safety, medical, health reason, or whatever. We're here to put out that information. We are here with our very own Dr. Vernon Rayford. We kid with Dr. Vernon Rayford. He is one of the newest members of Project Elect, and was about a year now. And so he's with IMA, and he has really been a leader when it comes to dealing with our health and things that have been going on. And so we're still here with COVID conversations. Dr. Rayford, it's been a while. I was looking back through some of the files, and we started this back in December of 2020.
Yep.
And so we were kind of topsy-turvy then. There was a lot going on. That was even before the vaccinations were approved. And look where we are today.
Yeah.
I just want to kind of go back, and I think it's been June since we have talked. There's been a lot that has happened with COVID-19, with the vaccinations, now the boosters. Can you just help us out? Because we are still confused, a lot of questions still about COVID-19. So I'm going to turn it over to you, and wherever you want to take us, let's go.
Yeah, I'm excited to be back. You're right, Robert. So much has changed since our last COVID conversation. It's amazing that in about 7 weeks, we would have been at this for a year.
Wow.
And a testament to the value of organizations like Project Elect, kind of to still be providing up-to-date information for the community. Since our last COVID conversation, there's been a lot of changes. At that time, it felt like we were on the other side. We were seeing lower numbers, relaxing, and then we were hit by the Delta variant of coronavirus. Coronavirus made a change. The Delta variant was a more contagious version. It was a version of COVID that was able to spread rapidly, and pretty much after that, after the last talk, we had just a surge, and so we hit what we described as our fourth surge or fourth wave. During that time, we had a rapid increase in cases, followed by hospitalizations, followed by deaths. Unfortunately, we've crossed some unfortunate milestones. Over 10,000 Mississippians have died since COVID was first recognized, and the Delta variant taught us a lot about the dangers of when we allow COVID to change. Particularly when we have really, really effective tools like vaccines, when we know that masking works, when transmission levels are high, when we know that group settings are risky indoors, when we have high levels of transmission. And so in the midst of Delta variant, we also, this was a tough surge because we did have a different COVID, but we were able to see that being vaccinated was very important in reducing the risk of death, the risk of hospitalization, the strain in resources. So at the time we were having the highest numbers we were seeing, we also saw the value of the vaccines. We learned things about the vaccines that when you think about the three things we like vaccines to do, we wanted to keep people alive, so reduce deaths. We want to reduce hospitalizations or severe disease, and then ultimately we want to reduce all infections. We learned that the vaccines did a great job, even with the Delta variant, of doing 1 and 2, keeping people alive and keeping people out of the hospital. We knew that there were some high-risk people that for other health reasons were just high risk, and we know that. We understand that with other things. we found that if there's such high levels of virus in the community, that there still could be indeed cases or infections in people who've been vaccinated. Many people took that to mean that vaccines did not have value. And in fact, you still hear people justifying their decision to not get vaccinated by saying vaccinated people can spread the infection just as much as unvaccinated people. The rest of that is, although they can, which is why masking is important, even when there's high levels of vaccines, when there's high levels of disease, there's been no doubt that vaccines have significantly reduced the risk of dying. And so during the Delta surge, as there was widespread, many of the vulnerable places like nursing homes were having infections and outbreaks. But in contrast to previous times in the pandemic, those nursing home residents who represent some of the most medically vulnerable people in the community, those residents were having mild infections. They weren't coming to the hospital. They weren't dying like they were dying just 6 months ago, just a year ago. And so we saw the value of vaccinations in terms of keeping people alive and reducing hospitalization. So the tragedy of the Delta variant and the fourth wave was that much of the death and disability and strain on our health system was preventable. And again, when we look back from that point of safety in the future, we're going to realize that that was one of the lowest points that we came to because we had an effective intervention, a miracle, the miracle that we prayed for last year.
Wow. I also wanted to ask, since the last time we've been together, there's something that's been called, and I'm going to try to get this correct.
Yeah.
Monoclonal antibodies?
Yep.
When someone actually you start getting symptoms of COVID, can you explain that? I never really was clear on how that worked.
Yeah, that's actually great, Robert. And so monoclonal antibodies are not brand new. The widespread use of monoclonal antibodies is relatively new. And so early in the COVID infection, so we're talking a year or a little more, we knew that giving monoclonal antibodies, which are just preformed proteins that are targeted toward COVID, and those preformed proteins, when given to people early in their infection, can reduce their risk of dying, reduce their risk of having serious disease, and also make people feel better sooner. And so I forget the exact time of year, but monoclonal antibodies were used when former President Trump contracted COVID. And he was actually given the antibody cocktail, or the monoclonal antibody, the same version that we were able to use during the Delta surge. And so the Delta surge was one in which we had probably the most tools. And unfortunately, those tools weren't used as readily. Many people who were eligible for monoclonal antibodies did not get them. Many people did not know to ask for them. Many people diagnosed with COVID who met criteria weren't offered monoclonal antibodies. But the monoclonal antibodies represent a tool that we have after you get infected. And what's really important about monoclonal antibodies is, or what's most important, is that you're diagnosed early. If you're diagnosed early and you meet criteria, and these criteria are very broad, which are appropriately so. If you weigh more than normal, you meet criteria for monoclonal antibodies. You do not have to be 65 or older. If you have high blood pressure, whether you take medicines or not, you meet criteria. If you have diabetes, whether you take medicine or not, you meet criteria. And it's very effective when used early in the course. In this time, we learned that you could give monoclonal antibody both as an IV drip or as injections under the skin.
Now, how long does that take
Yeah.
to do the drip or the injections?
So from start to finish, about an hour. So the drip from start to finish, about an hour, including that time would be monitoring time, where they're monitoring you. In terms of the injections under the skin, probably about 45 minutes. That includes monitoring time too. So these are very, not labor intensive. These are things that can be accomplished within an hour. And a good thing that we were able to see during the Delta variant is we were able to see how we in healthcare could upscale our ability to administer monoclonal antibodies. So much to the point that people could self-refer. You have a positive test, you think that you can be eligible, you present to places. There was a facility when the Delta surge was higher, a testing facility and a monoclonal antibody facility that was run by North Mississippi Health Services, where Sears used to be at Barnes Crossing. And so that where you could go get diagnosed, and if you met criteria for monoclonal antibody, which were very broad, you could get the monoclonal antibody there. And again, it could reduce your chance of dying, reduce your chance of having severe disease requiring hospitalization, and make you feel better. Of all the patients that I've had who received monoclonal antibody, to a person, they felt better. Some period of time. Some people it was, after I got that infusion, I felt better. Most people was, man, that next day I felt so much better.
Any side effects?
Side effects, the ones that we keep people for the 30 minutes or so,
Okay.
are allergy-like side effects. Anytime you're administering proteins or things we call blood products or things like that, we monitor people for allergy symptoms. So those allergy symptoms that we watch out for, rash, low blood pressure, trouble breathing, which is not very common. We, monitoring these folks. Other than that, just the discomfort of if you happen to have an IV, or the discomfort of if you're getting it under the skin, you have to receive 4 injections. And so the discomfort of getting 4 shots.
So just a couple of questions before we get into the booster and to the pediatrics. Recently, we understand that as a result of Project Elect, and I'm going to go into others, you have taken on a lot of the duties than what you do. And so you formed what we call a coalition against COVID-19 North Mississippi.
Yeah.
And so you guys have gone out in the community, you have set up shop, and you have put shots in over 1,200 arms. Am I correct on that?
Yeah.
So am I behind?
You behind.
Well, help me with that, because that's done a lot for North Mississippi and other counties.
Yeah. So if we go back to our COVID conversations, Project Elect was in the mix. And as we got the visibility from the COVID conversations, we found other community groups, other providers in the community who had that desire of, hey, let's get the information out there about the vaccines. Early on, we thought that the issue was going to be information. And so COVID conversations, but with the vaccine rollout, we realized that there was an issue with access. And so we were able to pivot to really think about how can we be accessible. And over time, as the groups came together, so kind of Liza Pillars, Hooks, Diabetes and Medicine, Twin Docs Healthcare, Project Elect, Mississippi Minority Farmers Alliance, Representative Ricky Thompson, we were able to come together and realize that, okay, you have to match the information with access to the vaccines. And so from that, first was identifying vaccine providers in the community. You can remember in March, early March, where we were able in Project Elect to connect national media to Dr. Amanda Griffin down in Holcomb, Mississippi, to highlight a community vaccine provider. And from that, in April, we were able to conduct the first mobile vaccine event in Shannon at the Mississippi Minority Farmers Alliance Agribusiness Center.
Shout out to Miss Carolyn, right?
Shout out to Miss Carolyn. And so from that, as we started out the first mobile vaccine event, we learned how to do it. And gosh, I've lost count of all the places that we've been. But as we figured out how to do it, we realized that it made sense to have an organization that worked with the partner groups, especially the founding partner group. And from that, the Northeast Mississippi Coalition Against COVID-19. So it's a mouthful, but it really encompasses that group, the coalition that we've worked through and currently work through to make sure that we're getting vaccines to people without as many barriers. You don't have to have internet access. You know, you don't have to have insurance. You don't have to have ID. We are coming to you, and we're going to some of the places. We've been as far south as Scuba, Mississippi, at EMCC. We've been at EMCC's Mayhew campus. We've been as far north as South Haven.
Okay.
We've been as far west as Marks, Mississippi, in the Mississippi Delta. And far east, we've been down to Aberdeen and Columbus quite a bit. And we've been at places from churches to personal care homes. We've been in the jail. We've been in the police station, municipality. And so we've been in those places, and we're still going to the places. We've been in schools. We've been outside a couple of times at football games, giving shots. And so we've actually given almost 1,500 vaccines.
About 300 behind.
About 300 behind, and a testament to with boosters, and we'll talk about it, the number of vaccines we're given has picked up tremendously. And so, you know, about a month and a half ago, we were around 1,200, and we're about 1,500. And, you know, our goal is to continue to get as many vaccines as we can. So we're excited about our expanded understanding of the vaccines in terms of who needs boosters. We're excited about the expansion of those who are eligible for vaccines, which include kids as young as 5. And so we definitely ought to talk about those things, you know, as well. Other good thing about our organization, the coalition, which we call ourselves, we're now a 501c3 organization.
Congratulations.
So that for those who are listening and you have a desire to support us financially, our tax exempt status allow you to receive a tax deduction. And so, you know, seek us out. We really want you to support us by spreading the message of where we are. We've been really, really successful. Gosh, you know, our who's who list of folks we vaccinated. We vaccinated physicians, school superintendents, police officers, you know, regular everyday people. And we're just really excited about, you know, that work. We couldn't have done it without Project Elect. And another good thing about the coalition is in partnership with Project Elect, helping deliver information in settings like the COVID conversation. So we're excited now that the coalition gets a chance to support Project Elect in the COVID conversations going forward.
Wow, that is awesome. And so I just wanted to set the foundation, because with these 1,500 people that would not have been vaccinated, if people like yourself, the professionals, and if I begin to name the doctors that we have interviewed here, I probably would leave someone out. But we're got some things coming up where we're certainly going to remember them. So going into the booster.
Yeah.
And so that's been a lot of hard work to get the first shots in the arms.
Yeah.
And so now technology, we're getting information, we've got the booster, we've got those approved. Who is eligible for that, and who do you recommend run and get them like now?
Yeah, that's actually a great question. If you're thinking about a booster, you're probably eligible. And what I'll say to kind of go back is, our understanding that there's a need for boosters means that we, in the medical community and the scientific community, we're doing our due diligence. we learned that the vaccines provided great protection, which decreased over time. And that decrease was more significant in people with certain risk factors. And with that understanding, we recognized that maybe we needed boosters. And so not only was there a recognition, there was a testing of that recognition. So we didn't unleash boosters without studying the impact of boosters. And as things happened, Pfizer was further along with their data than Moderna and Johnson & Johnson. And so it began a very confusing picture that at the beginning of August, we learned that some people needed a third dose. And this is where it's probably going to get a little confusing. So at the beginning of August, there were many people who could have gotten a third dose but didn't because there was confusions around a third dose or boosters. And what we learned is there are people who, for either their medical condition, cancer, medicines that they take, people who take transplant anti-rejection medicines, people who take immunosuppressants, folks who have autoimmune, so they have to suppress their immune system to stop a disease process. We learned that those people don't get the same response from 2 Pfizer or 2 Moderna or 1 Johnson & Johnson than compared to folks who don't have those conditions or don't take those medicines. What we learned is they do if they get a third dose. And so at the beginning of August, if you had a condition or took a medicine that made you moderately to severely immunocompromised, you could have gotten your third dose of Pfizer and Moderna, or a repeat dose of, well, we didn't have a recommendation for Johnson & Johnson at that point. So in August, it was, you can get a third dose of Pfizer and Moderna. And for those people, that third dose could come as soon as 4 weeks after the second. So that special group, which was a small group, could have gotten third doses as soon as August. So if you look on some of our social media posts, you know, it can be a little complicated for people to really know, hey, am I in that group? And some of my posts where we list the medications or the conditions for those people, I have folks who are getting treatment for cancer, which is another reason to get a third dose, waiting until October to get their booster when they could have gotten their third dose at the beginning of August. And so third doses and boosters are not the same, and it's an important distinction because the circumstance is different, and for Moderna, the dose is different. This may be something that you need help with. So if you're thinking about a third dose or a booster, talk to someone, a nurse practitioner, physician, talk to your physician, your nurse practitioner, to kind of help you decide, because for Moderna, it's different. For Pfizer, it's not. But for Moderna, it's really, really, really different. And so I encourage you to talk to somebody about that when we talk about third doses.
Now, that also brings me into mixing and matching.
Yeah.
So I had Johnson & Johnson, so I would be reluctant to really go to one of the other vaccines. Will that be a problem if I decide to?
Nope. So in the time since, over the last 2 months, we've learned that boosters are needed for most people. And I'm gonna go through who needs a booster as soon as possible and who I'd still recommend a booster for. If you're 65 and older, get a booster as soon as possible, as long as it's been 6 months since you had your first Pfizer or Moderna. And I'm gonna talk about Johnson & Johnson separately.
Okay.
So if you got Pfizer, you got Moderna, it's been 6 months, get a booster, get a booster.
Okay.
If you're 18 to 64 and you have chronic health conditions that are real common, blood pressure, diabetes, kidney disease, heart disease, are overweight. And so that overweight criteria hits a lot of people. And so that's the reason I say if you're thinking about a booster, you're probably eligible, because the most common thing that we all share in Mississippi is being heavier than normal. And that's just, from my standpoint, that means more people are taking advantage of the booster shot. We can work on that a little later in the future. But those are the conditions. If you're 18 to 64, get those. I encourage 18-year-olds to get it. There's not a shortage of vaccines out there. And so I'm a lot more liberal about the vaccines that we have. If we don't use the vaccines that we have kind of in the borders of Mississippi, it's not like we can ship those to another country. And so if we don't use those vaccines, there's a high chance that those vaccines are going to go into the garbage.
Wow.
So that means that most people, like I said, if you're thinking about you can be eligible for a Pfizer Moderna booster, you probably are. And then the last piece, which is really important, if you have a high risk of contracting COVID. So if you interact with the public, that's all you need. You interact with the public, if you have a very public-facing job, if you work somewhere and many of those folks aren't vaccinated, even if you work, with 4 people and 3 of those folks aren't vaccinated, that's enough for you to get a booster.
Wow.
That's enough for you to get a booster. So, for me, if it's pretty much, I haven't found a scenario where I found one person that I said, oh no, you don't get a booster. There's some real narrow exceptions that some people may bring. Well, what if you're allergic? Those are real narrow, because that number is really low about those who are, who have allergy. In terms of what to expect from the booster, and side effects are about the same as the second dose. So sore arm, which most folks have, tiredness, headache. Some folks could have things like fever. If you got it around the second dose, may happen. What we know is usually really short-lived, 24 hours or less, and it's okay. And the last thing, Robert, was you talked about Johnson & Johnson. So we also learned that what we originally thought and hoped was a one and done was not. And now, because Johnson & Johnson is not one and done, if you're 18 and older, so anybody who got Johnson & Johnson are 18 and older, and it's been 2 months since you got your J&J shot, you need to get another dose of something. And that's where mixing and matching can come into place. We've learned that when you allow people to get a booster of a different brand or version, that booster didn't cause any trouble, and those folks had an immune response. And so, interestingly, they studied groups that got Pfizer first, Moderna first, J&J, and they mixed it up, and they found that you had good antibody response if you got something. And so for those people who've gotten Johnson & Johnson, the booster recommendation is, if you got Johnson & Johnson and it's been 2 months, get a booster dose of something. Johnson & Johnson has been a little harder from a supply standpoint to get. And so most often the options are Pfizer and Moderna in terms of the booster. Pfizer is the same standard dose. Moderna, the booster dose of Moderna is a half dose. And so it's important to know, again, Moderna, whether you're getting a booster dose, a third dose. So for all of those who got J&J, when our first vaccine event, the vaccine that we gave the most of was J&J. And so for those people, it's been 7 months now. I encourage you, if you're listening, to come back out where we're going to be and get a booster of something. Most likely it's going to be Pfizer or Moderna.
Okay, something that's near and dear to our hearts, our babies. And this shots being approved for our infants.
Yeah.
I was toddlers. And I was listening to some news brief and they were interviewing some parents and they were like, no.
Yeah.
my baby is not getting a COVID shot. What do you say to that?
You know, I really want to talk and understand and maybe even explain the process. And so some people don't understand the process that we've gone through. The difference has been the speed and the magnitude of the things that we have in terms of the process that has gotten us vaccines as fast as we've gotten vaccines. The normal process for medications or things, we tend to start with the most affected population. And so if the most affected population is adults, we start studying and testing adults first. Not because it's dangerous to kids. So many people think that because we didn't test the vaccines on kids first, that there was some kind of danger. No. You started with the most affected population. You excluded groups that you were going to come to a little later in the process. Pregnant women, kids, people who were on immunosuppressants. And so you start out when you study things with kind of a narrow group, and then over time you expand the groups. And so many people think that because we didn't start testing the vaccine until recently in pediatrics, so 5 to 11, that there was something dangerous. No, the process just worked that adults were the most affected group. And so the need was to get the vaccine to adults first and then start expanding the groups. And over time, we've expanded the groups. Over time, we learned that the vaccine works well in pregnancy, and it doesn't harm the mama, doesn't harm the baby. And we've expanded it. And so people with weak immune systems, we learned that the vaccine didn't hurt them. And in fact, they need a little more than what we standardly give. And now we got to that point, and one frustration was that it took us this long, but it is a testament that those people who were over the process, they stood their ground. They stuck to the process of saying, we're not going to go faster than the data that's out there generating. And I think I can see that as a clinician saying, went through the process. Yep. Process similar to what happened in adults. Yes. The data's out there. Yes. The data shows the benefit. Yes. Was there enough folks studied to kind of get to the conclusion that we got? Yep. And so now we have the recommendation that as young as 5, so as young as 5 can start getting Pfizer. Moderna's still studying the pediatric population from 5 to 17, but Pfizer was the one with the most advanced data, and it was able to show that the vaccines were safe and that they worked really well. And so now we have the ability to vaccinate our 5 to 11-year-olds along with the 12 and up. And so we learned that if you just look at things like who's in the hospital or who's dying, kids didn't make those groups up. And so some people will make probably a disingenuous argument that kids aren't affected. But I would ask them, how much is a kid affected when their mom and daddy's dead? How much are they affected when they can't go to school? How much are they affected when they're burying grandma, uncle, aunt, and all that? And so those who were interested in making a disingenuous argument about the relative benign nature of COVID in kids missed the incredible impact that science has told us that the really important thing for a child is his or her environment. And COVID is no doubt so disruptive to their environment that we're seeing more mental illness, more school loss. Folks are losing, academics. Vulnerable populations are getting further back. And so that argument that we're not going to vaccinate our kids because they're not at risk from a medical standpoint is missing the point that COVID affected our community. and that COVID won't go away until we as a community have a community-wide tool.
One question, well, really a couple. I want to establish your credentials. A lot of people say, well, we know you're a medical doctor, but when we start talking about pharmaceuticals, and we started talking about kids, and we look at you around here as saying the adults in IMA, but I think there's a background that you have that qualifies you to, and there were some strong statements you made, and you're qualified to make those statements. Let's establish those qualifications that you can make those statements and they are legit.
Yeah. So I'm actually board certified in pediatrics. I'm dually trained in internal medicine and pediatrics. And from a pharmaceutical side, before I decided to go to medical school, I completed pharmacy school. So I have a doctorate of pharmacy degree. And during medical school, worked as a pharmacist. And so, a lot of these topics are things that I've had the training. And I thank you for kind of pausing and, asking about credentials. Because, where we are here in another potential tragedy of our time is that there are more voices in the square and less knowledge. And unfortunately, the more knowledgeable people or qualified people may not be the best deliverers of the information. And so the professional spinners have really taken this and run to the detriment. And so what I found is that has really confused people. And people have the perception that there is more debate than there actually is. And that there is a lot less debate. There's a lot less debate. When you look at physicians, clinicians, there's a lot less debate when it comes to the value of vaccines, the disruptive nature, the dangerous nature, the deadly nature of COVID, and the tools that we have. There's not a lot of debate that the ones that work really work. You have people who try to think magically and try to make stuff that don't work, and to the detriment of people, to the point of people going to livestock stores to buy livestock medications. But I will say that medicine does have a human version, just doesn't work. So I probably would tell people, and that's probably on my list, trust the people that you were trusting pre-COVID. Also trust people that you have access to if they're wrong. And so if I'm giving you this advice and I live in a community, when you see me, you'll get to tell me that I was wrong. Those people who are somewhere miles away from, many miles away in internet land, when they're proven wrong, and most often they are, where are they when you're the one suffering? When you're the one, burying your relatives? When you're the one harmed by the intervention that you thought that the intervention that they recommended. So it really does matter who's giving the information. It does matter, and it's for someone. You want to know that the person writing your prescriptions is trained to write your prescriptions. You want to know that, and so I think it's fair. It's fair to ask what what criteria allows you to be at the table, and I actually encourage people to curate their space, to curate your social media. If social media is going to kind of be your information bubble, I encourage you to curate it. I encourage you to curate it and say, I'm just going to mention who the newspaper is talking about today. Matthew McConaughey talking about vaccinations. When your child has a fever of 103, call Matthew McConaughey. Aaron Rodgers. When you have COVID, call Aaron Rodgers. And so just to really kind of don't let this celebrity culture mess let you get in trouble, because these people live a life of privilege and they're actually protected from the scourge. Aaron Rodgers has people who actively monitor who he's around. Many of these folks who are advising this comes from a position of privilege that we don't have. And so a lot of these folks are protected by the very nature of the platform that they're using. They're stars. There's TV hosts. You got security guards that don't let regular people come up to it. Guess who's not protected if you're working with the public? Guess who's not protecting you from that customer coughing on you? And so really think about those. And it's shameful that the messages from the protected, privileged messengers causes so much harm.
Wow, that's very powerful. I was just sitting here thinking while you were talking that I don't know what our time is looking like. I know we're going a little long, but this is God, this is good. Got about 3 or 4 minutes. 2 quick things. Holidays are coming up.
Yep.
Again.
Yep.
I am sick and tired of this,
Yep.
but I wear it.
Yeah.
And we know we got family gatherings coming up. We still doing church events, government funerals, all of these things. What is your final say so about the masking?
Yeah.
And the distancing?
I'll tell you that it's been 20 plus months. We can't stay in the cave. So we're going to have to come out of the cave. We're going to have to come out the dens, come out the man caves, and we're going to have to reestablish what normal looks like. Number one, we're not going to get back to the normal that we knew of February of 2020. Not coming back. And so that's both disheartening, but it's also great because there's some stuff that I'm not wanting to come back. Evening meetings all the time. Thank goodness it's gone. I can watch the meeting on the treadmill. But I will say that as we envision holidays and gatherings are important to us. And this year, we have our best chance to start recreating that normal for us by using the tools that we have. And so if your family's sick of masks, first, make sure that everybody is vaccinated and got their boosters. Make sure that everybody around there is vaccinated and got their boosters. And if you still have some folks that's holdout, tell them that we're going to be outside no matter what the temperature is. And so using the tools that we have, vaccines are the most important tool, the best tool, the most effective tool, the freest tool. Listen to me, free. Vaccines are free. Make sure that have that conversation as a group. I think families should start planning to get back together, but they're going to need to plan to get back together safely. And so this time last year, definitely a little bit more hesitant, reserved. But I do think it's time for us all to learn safer ways to do the things with tools. Depending on what the numbers look like, we might have to wear the mask some when we're not able to control other stuff. We know that inside is more risky than outside. And so this could be the time to be fun. Open that garage door. Set that table up outside in the garage and have that door open. You got great ventilation. If you're in church, tell everybody to dress warm. Crack that door open, crack the windows open, keep ventilation in there. When you're inside and you're close, I think the mask is a safe option. If you're outside and you're not just kind of crunched up on top of each other, I think you can not necessarily wear a mask, especially if it's perfectly ventilated. And so we know that outside is a much safer kind of thing. Vaccinations are great. And then on the flip side, we also know that, gosh, God forbid, COVID does happen, we have tools like the monoclonal antibody. So I encourage families to start thinking about how they're going to gather. I think they should gather not in defiance of COVID or in ignorance of the way we know COVID spreads. I mean, we know a lot about how COVID spreads and there's not a lot of ambiguity. And we also know that flu is going to be a factor too. And so we really have to take take heed that this winter we'll have a more active flu season. We'll have more active other respiratory viruses. And so really rethinking, how we do the things, and, top 3, get vaccinated, try to do it outside, try to make it as spacious as you can. And repeat, number 4 would be get vaccinated. Number 5 would be get vaccinated and the booster. But, I think I'm looking forward to figuring out how, my family can get together for, one of the holidays, and I encourage families to start thinking about it. Just, the more you think about it, the more forethought, I think you can have the safest possible event possible, that you can do. And I can say in my family, we've done some things that we hadn't done that we found was really, really fun, and look forward to it. Fire pits are popular, be safe. But, fire pits are really something that's really nice that, just kind of families can fellowship, see each other's faces, communicate, tell stories around the fire pit, and, still be together. So I encourage families to find safe ways to be together.
Wow. Thank you. There you have it, folks. Project Elect, we're trying to continue to spread this information about COVID. We have our experts, and anyone that listened to this tonight, I think that we are more educated on where we've been, where we are, and where we're going. We're going to continue to work hard to put this out there. We ask you all to share this video, Project Elect Tupelo. This is information that you're not having to pay for. Share it, call up people, tell them to watch it. If you have any questions you're not sure about, just inbox those on the Facebook, and I think Dr. Rayford would be proud to answer those questions back. Man, how easy is that? And I don't know about y'all, but I'm ready to see COVID crushed. I'm ready to see back to normalcy. I've seen enough of people dying of this disease that probably could be preventable with what has been out. I've seen enough of the funerals. I've seen enough of the kids that's in the hospital, the grandmas and grandpas. I've seen enough of not being able to say proper goodbyes, or to not visit in or out of state, and the laws that's in place. I've seen enough, and I think you all have seen enough. And if you have, get those shots, get those boosters, get information from Dr. Rayford and people like him. So again, until next time, Project Elect, enthusiastic leaders engaging in changing times. And to all, good night. Is there any other?
Well, I'm actually going to take over the hosting duties. And so, I'm really excited to ask you about this, Robert. Something's going to be happening on November 30th. And it's really exciting. I'm here with a star. And Robert's going to tell us what's going to happen on November 30th.
Well, yeah, put me on the spot.
On the spot.
We're going to be filming actually, we have a watch party. It's going to be Badged and Broken, the Robert E. Hall story. Just a life story of a professional police officer in the career. And so it'll be open to special invited guests at this time, but soon it'll be going public. And you put me on the spot.
So Robert's talking about the story like it's not about him. So this will be the trailer for the movie that will feature Robert's life, that would be based on a book.
Yes. And
chronicling his life and the work that he's done in the community. And so a lot of humility there. But we're really excited that Robert's getting that opportunity, and excited to share that. As looking at kind of just a testament to the good works that we're talking about, movies, and that fun thing that I don't know if I'll ever get to say. I wonder who's gonna play me in the movie. Oh, Robert, who's gonna play you in the movie?
Well, I haven't gotten a call back from Denzel or Will Smith yet,
Gotcha.
So we'll see. Actually, it's a young gentleman that's in the trailer. His name is Artrell Smith. He's from South Louisiana. We're looking forward to meeting him, and he'll be at the event. So
Nice.
So we're looking forward to meeting him.
So November 30th. And now, now we can wrap up. So we look forward, we're excited about these COVID conversations, and, we look forward to coming back. Almost I can get up here and talk on my own. So I thank Robert for humoring me and just kind of interjecting when I'm rambling.
Yeah, I still got kind of heated up here now, so.
But
thank you for that.
Share the events. Look forward to our next COVID conversation. We'll let you know. Have a good night.
Happy Veterans Day.
Happy Thanksgiving.
Veterans Day.
Veterans Day, happy Veterans Day. And I also wanted to make sure, Maurice Shumford, our Project Elect Secretary, the man behind the camera, and we also have always supportive Kenneth Wheeler, our Vice Chair of Project Elect, and we thank you for the use of the facility and North Mississippi Medical Center partnership. So thank you.